Well, welcome to episode 6 of our podcast series, Healthy Perspectives with Dr. Bruce Vanderhoff. Thank you for joining us. Today, our focus is on a new statewide children's vision initiative that we call OhioSEE. We're very excited about this program, which the Ohio Department of Health is administering. It's a program that brings vision care and glasses, if needed, to thousands of students across the state and at no cost to the family. It began in January, and we've already seen tremendous growth and results, and we're looking forward to continued expansion as we head into the latter part of this year and the next school semester. We'll talk a lot more about OhioSEE with the help of our guest today, Dr. Sergul Erzurum. She is a pediatric ophthalmologist based in the Mahoning Valley, professor of surgery at Northeast Ohio Medical University, and president and co-founder of the nonprofit Sight for All United. Welcome, Dr. Erzurum, or I guess I should say Professor Erzurum.
Please. Thank you so much for having me. It's so exciting to talk about this program.
Yeah, no, it's great to have you here and to be able to talk about it. So I want to start with a little bit of background because other people don't know you the way that I do, having worked with you now for a while. Can you just share a little bit about how you became interested in and then involved in pediatric ophthalmology in the first place?
Yeah, so during my ophthalmology residency, I had the tremendous experience of working with a pediatric ophthalmologist at Northwestern University who was just a great mentor and really taught me the joy of taking care of children. Yeah. When I worked with him, it wasn't like going to work. Yeah. You played all day and got to engage. And I think what was the most impactful for me is, although as an ophthalmologist, we're impacting people's lives and sight and giving them back their vision in many ways, for a child who's starting out on their life, you're making a huge impact in their future.
Yes.
And that's what I really liked about it.
Yeah, no doubt about it. Well, as a pediatric ophthalmologist, particularly with the career that you've had and the kind of focus that your career has had, you've worked with a lot of eye professionals, not just ophthalmologists, and they've been important to your work. Can you just describe some of the other eye professions that you work with all the time?
Yeah, so there is quite a joining of specialties to really accurately take care of someone's sight, starting from ophthalmic assistants in the office and ophthalmic technicians who help us do our work, to your opticians who measure the glasses, to the optical labs where they're making the lenses. There's a multitude of specialties that are not normal to the profession of medicine.
Yeah. And then how about optometrists? Because I know that as an ophthalmologist, you and optometrists interface around the diagnosis and treatment.
So, my practice that I'm in was actually the first practice to introduce optometry and ophthalmology working together in the state of Ohio. That's quite a while ago now. Yeah. But I've always been a very big proponent for optometry and ophthalmology being collaborative and working together, because there are not enough of us to do it all. And in collaboration, we can take care of the areas that are major to our skill set. Yeah. And really focus on what we do best.
Yeah. You have really been a pioneer in the work of helping to ensure that kids get the eye care they need. And you've worked very hard to find ways to make sure that kids don't slip through the cracks. Tell us a little bit more about that. Like, how did that come about? There's plenty to do as a pediatric ophthalmologist, just, that is more sort of the everyday.
Yeah.
Your career has caused you to become engaged in philanthropy and bringing together community. How did that all come about? Share that story.
I feel so blessed because I think the part of my life I enjoy the most is the part that engages the philanthropy and public health and what we've been able to accomplish to put a light on some major problems in children's vision care. But you're right, it was not a path I actually chose. So I've been in practice now for 32 years. I consider ophthalmologists family doctors for the eyes.
Yeah.
And especially for children. When we take care of children, they come into us with a problem, and you're taking care of them for a minimum of years, a lot of times decades, and sometimes even to adulthood. And so you get to know the whole family. You're taking care of the parents, the grandparents, the siblings, the cousins. And so as you start looking at these conditions and diseases that are being sent to you, you start to recognize a pattern of when you can intercede and have more impact. And you realize that the sooner you can get to the disease, the more likely it is you're going to preserve a child's sight.
Yeah.
For example, amblyopia. 96% of amblyopia is treatable if you catch them in time.
Yeah.
And 5 or 6 or younger is the best age. If we can catch them by 7 or 8, we can still make an impact. But once you get past 8 years of age, that impact is decreased. Yeah. Now you add a child who comes to see you at the age of 10 who's got crossing of their eyes along with amblyopia. I might be able to fix their vision, or their crossing, but I can't fix their vision because that's permanent. And so in a decade, that eye will start to drift again. If we can get that child when they're younger and fix the vision and then deal with whatever comes after, their success to maintain their best sight, their best binocularity is achievable. And so as pediatric ophthalmologists, we're always looking for the source point. And pediatric ophthalmology and pediatric optometry have really made a lot of efforts in screenings and trying to be very impactful in identifying disease. So that's, I guess, how I sort of got into it.
Yeah. It's interesting because I just got done reading a really good book about Ulysses S. Grant, written by Ron Chernow. And in it, he really describes how Julia Grant, his wife, who had significant amblyopia, really struck, that was hard for her. She always sat for portraits on the side so that people couldn't see it. She felt a social stigma related to it. And of course, there were vision issues. Grant would read to her each evening. She enjoyed that because she found reading difficult. So I think we can sometimes forget that a lot of what we're talking about really is an essential part of pediatric care. That the sense of vision is just so important. We talk all the time about how, for most of us, 80% or more of our learning comes through that sense of vision. And if we're not taking all the necessary steps to identify problems and address them early in a child's life, we're really potentially missing out on a window of care, and that's a shame. Well, speaking of leaders, Governor DeWine shares frequently the fact that he had a conversation with you early on that really highlighted in his mind that we might have a problem as it relates to this very issue of effectively identifying and addressing kids' vision problems at a young age. Share a little bit about that conversation and, essentially what was the problem that you were highlighting for him?
So, I was so, I consider it very lucky and fateful that I even got a chance to sit and speak with Governor and First Lady
Sure,
DeWine.
yeah.
It really was truly an honor that they would take time to listen. I'm not a politician, and I'm not a lobbyist of any sort. So when I went in to speak with him, I spoke to him as a physician and a patient advocate.
Yeah.
And what I took with me were statistics and stories of children and what they have been through and their success stories. And as you speak about the 80% of our learning comes through our eyes, we spend kindergarten through third grade learning how to read.
Yeah.
And from third grade to graduation, we read to learn.
Yes.
So if we can't read, we are already suffering from a definite obstacle.
Yeah.
The children by third grade have lost their confidence in their ability to read. By middle school, they're lagging behind, and there has definitely been relationship with being held back in school due to academics and decreased graduation rates from high school.
Yeah.
Then you're talking about college matriculation and job placement, getting a driver's license, all the things that allow you to become independent. But of course, the governor and first lady are very concerned about reading. And reading is definitely impacted by a child's ability to see. If we look at studies, it has been shown that a pair of glasses can improve a child's ability to read. And if you look at our children who are in the lowest quartile, a pair of glasses can increase their reading by 4 to 6 months of improvement.
Yeah.
And I've had some anecdotal cases that were just so wonderful. I shared one story of a school teacher who had to go out of her way to call me at my office to give me the results. So we had gone to the schools, we did our eye exams, we dispensed the glasses. Being in that part of the system, we don't get to see the kids in the classroom. So about a week or two after we had been at this particular school, a teacher leaves me a message at my office and says, please call me. So I'm concerned something happened to one of the kids, so I give her a call. And she goes, I just have to share a story with you. This child was new to our class at the beginning of the year, and I was working with her to read, and she just couldn't read. And you guys came in and gave her glasses. And we sat down and started working with her with glasses on. And she read a paragraph and looked up from the book and said, I'm not stupid. I just needed glasses. That is a beautiful story. But on the other hand, that child had assumed
Yes.
her own stupidity, her inability to perform when that wasn't the problem. And something as simple as a pair of glasses changed her world. And the teacher just was overwhelmed by this and had to share it with us. So that's what we talked about with the governor.
Sure. Well, and he is a leader of action, and that led very quickly thereafter to him commissioning the Ohio Children's Vision Strike Force in 2024, which you were a member of, along with many people who care about this issue. And I was privileged to chair. And what became very quickly evident in that work was, we had workable models here in not just the United States, but right here in Ohio, where we could potentially build and where we saw success occurring. And that success really could be amplified and taken to more communities. We were able to successfully describe this to our legislature, and thankfully, the legislature provided us with funding, $10 million over the biennium, which has enabled us to begin a pilot in the state in 15 of our counties that have the greatest need. Now, recognize that as we looked at the data, there was no county that didn't have need.
Exactly.
There was substantial need in every single county. But the 15 we're starting in were the ones where we had the greatest opportunity to have initial impact. And so we have focused on those counties, a group of counties that actually turned out to be a mixture of urban, rural, suburban populations, again illustrating the fact that no community is spared this challenge. Another way to say it is no community has been doing a great job of addressing this challenge. And what a shame. I can't really think of anything that we would feel more remiss about than not helping our children achieve their potential.
It's very complex, right? I think the state of Ohio has great screening rules that are mandatory.
Yeah.
Some of the best in the country,
Yeah.
right? I mean, if you look at all the other states in the U.S., they do not screen children for vision problems as much as we do.
No, we're a leader.
Yeah, we are a leader in screening. And, it's not that we're not screening. I mean, 60% of children who fail their vision screening don't ever get an eye exam. So that's
incredible.
That's a major problem. And, I myself thought, I'm doing a great job.
Yeah.
I came to the Mahoning Valley 32 years ago because there were no pediatric ophthalmologists.
Yeah.
I came to make a difference. And so I thought, I'm providing access to care. Mm-hmm. There's not going to be any child in our community who can't see.
Yes.
The year we set up the foundation, Sight for All United, that was 2016, within a month, a school nurse had called us and said it was a small charter school. She goes, I have 95 children who failed their school vision screening, and they still haven't gotten an eye exam.
Yeah.
Will you help us?
Yeah.
So we didn't have a program then, but we said, of course we're going to help you. So we rallied and created a quick team, and I was shocked at the outcomes. 85 of the 95 children had major vision problems. Major.
Yeah.
Could not see across the room.
Yeah.
The majority of which could be fixed by a pair of glasses. A handful needed medical problems. One needed immediate surgical care. Mm-hmm. And it was an eye-opener to me. I had been in this community for 20 years, and I thought everyone had access to care. I didn't deny anyone by insurance or ability to pay. And this school taught me that access to care is more than having a doctor in the community.
Yes.
Access to care is a much larger problem, and it is multifactorial.
Yes. Yeah. Yeah. And so we're bringing all of that to the students where they are. So the student doesn't have to miss school. The parents don't have to miss work. Transportation, which could be an issue, is not an issue. Worries about finances aren't an issue because while we bill for insurance if it's available, we don't let that be a barrier.
Right.
We are providing the care, and at the end of the day, we're not asking any parent to be responsible for this care. We're going to get it covered. So it's really a wonderful program. We're, of course, very grateful for the legislature's confidence and investment. Just to share some quick statistics, now, this really just got going in January. We had a few months to do some work right after the legislature said go, and then we went right to work. Nearly 1,900 eye exams already. Nearly 1,200 pairs of glasses. In those 15 counties, we're in over 86% of the public districts. That's 137 public districts, 59 community schools, and 36 non-public chartered schools. So just off to the races.
It's exciting.
It's very exciting.
I don't think people realize how much effort it takes to get a school enrolled.
Yeah.
And to get a program up and running.
Yeah.
So those numbers are phenomenal because the majority of those schools probably, you couldn't get in there to be doing exams in January.
Yeah.
So that's amazing.
Yeah. We, of course, now have another opportunity in front of us because with the Rural Health Transformation Program, within the context of that grant, $25 million has been identified as targeted to this work and helping to expand this to all of our rural counties across the state, which is both a blessing and a challenge, right? Because now working with partners, we're going to have both the opportunity and the challenge of moving from 15 counties to all 88 counties of the state. So a wonderful thing, but a lot of inherent challenge. What I'd be interested in knowing is sort of, so what do you think? You've been at this work for quite a while, and now we've seen this again, Ohio taking a leading role for our children and for their vision. We've provided really a model for the country, and we do know that other states are looking at us and are looking to reproduce what Ohio is already beginning to do. Tell me about that. That must be gratifying at some level to you.
So, you and I have been talking now since 2024.
Yeah.
Right, when the strike force started.
Yep.
And, at every step, you've heard me with my excitement and then my fear.
Sure.
So you get excited because you're moving forward.
Yeah.
The fear is that we won't do it right. And it's so important that we do this right. So first of all, I have to say kudos to you and the ODH. Starting from the strike force, the people around that table, in the room, the information that was collected, and the way you processed it. I mean, everyone's going to say it's a piece of cake to analyze these things, but to understand the ophthalmic world and all the pieces that don't exist in any other field of medicine, it's not easy. There's a lot of pieces moving. And so I think that the ODH has done a phenomenal job absorbing the problem and understanding how to execute the solution. At every stage, when you have such rapid growth and confidence in the program, there's a fear of moving too quickly, right? Because you want to make sure you're doing it right and that we've learned from the first 15 counties, so the next step we evolve into is better.
Yeah.
And I'm sure you're already doing that. I'm incredibly excited about Ohio being the leader in this, and I know other states are looking. No one is near what Ohio already was doing, but for us to have a program which is actually run by our state health department is a major bonus. And so, your leadership has made this really phenomenal. You really have. So I'm excited because of what you've already done. I think it's on the right foot moving forward. And I think the federal government coming in here and saying they want to see more of what you're doing is proof and testament that we're doing really well.
Well, thank you for the kind words. I, of course, have to point back to Governor DeWine, who has been the motive force behind all of this work in progress. Wouldn't have happened without him. I also have to point back to, though, the eye care professionals like you, our optometrists, the strong support we've gotten from eye doctors generally across the state, as well as other eye care professionals, educators, who have been incredibly supportive of this work. The educational community has just been phenomenal. Our school nurses.
The school nurses are your biggest heroes.
They've just been wonderful.
They really are.
They really have. And I could go on down the list. In fact, one of the hesitations I always have about calling people out in thanks is that I'll forget somebody.
Absolutely.
And you know that there are just lots of people who have helped make this work happen.
Absolutely.
So I really want to thank you. Thank you for the work you've been doing before this happened. Thank you for being a part of the podcast today. And I want to encourage school officials in our eligible counties who are not signed up for this program to do so by visiting our OhioSEE webpage. You'll find that by Googling OhioSEE, or go to odh.ohio.gov and use the search function for OhioSEE. And as a reminder, you can find our podcasts at many locations on the ODH website, through the Media Center page, and on our ODH YouTube page, or through the Amazon and Spotify platforms. So thank you to everyone who's joined us.